very, very exciting for us. I'm very glad you're here. We have a whole team of people here to inform you about the project and to explain some new things that are coming down the pike that hopefully you'll be interested in. So to launch this event, I'd like to introduce George Bischalaney, the President and CEO of Eden Medical Center.
Thank you, Sandy. I want to welcome you all too, and thank you for being here and your interest in what's happening at the Medical Center. I'm going to begin the project, begin the discussion tonight talking a little bit about the project. And I want to talk about what our vision is for the project. A project of this size and this scope is pretty significant for our community, for any community. We don't get to rebuild hospitals very often. So the team set about creating a vision to frame the whole work, everything that we wanted to do, and this vision is here. We want to create an extraordinary landmark, a regional medical center that integrates advanced technology and a place for physicians to work that's outstanding, for employees to work, provide the best care, and the best place for patients to come in our community. And that's really important because we recognize that this building, the building itself, has been a landmark and icon in Castro Valley for many, many, many years, 54 to be exact. And what we wanted to do, and you'll see I think the team has done, is create something just as significant for the future. So our goals are, I think I'll get on this side. Our goals are to create a safe, healing environment. We want a facility that provides a safe place for patients to come where they can be healed from illness and injury. We want to provide something that's accessible but affordable, and affordable is critically important these days. There's no small amount of press that talks about the high cost of health care. That begins with the cost of construction that runs in excess of $2 million per bed, is how we measure it in terms of rebuilding a campus like this. So affordability is critical. We also want to have the most current technology that we can have, that we can predict in this building when it opens in a few years. And we're constantly chasing technology in medicine. Things we buy today are old in 4 or 5 years. So we're constantly changing the technology trends. So we're focusing on what the best designs are, and the team has designed a building around these concepts to have the best technology, both in information and in medical technology. We have to keep this building fully operational during construction, and that's no small task in itself. As you'll see in the footprint, as one of the team members will show you, that we don't have a lot of space on this land. So finding a place to rebuild the hospital of the size and scope we need is pretty challenging, and is going to challenge our ability to stay operational, but the team is committed to doing that. And of course, we want to build in a green mode, and you'll hear some discussion about that today. We want something that's appropriate for the environment, that reaches a sense of comfort with the environment, if you will. So we've taken a lot of technology and a lot of ideas into play in rebuilding a campus of this size. Well, why do we need to do that? I think it's obvious to a lot of us. We've been talking about it for so long, but if you're not aware of it, the California legislature passed a bill a few years ago that required all hospitals to meet new seismic safety standards. And we have to do that by 2013, which is a 5-year extension from the original legislation, which was 2008. It's a significant task to get there by 2013, but we're committed to doing that, and you'll see in our project today, in our plan, we can do that. If we don't do that, this hospital can't operate. Literally, the doors will close for all inpatient services at the end of 2012. We want to preserve these services in our community. We're going to continue to have emergency trauma services, maternity services, our neuroscience services, and of course our medical and surgical services here. We're focusing the campus and the design around patients. You see here, one of our needs is to create an ideal patient experience, one of our goals as well. The team has designed the building in a way that really is more focused around the patient than hospitals were when this building was created 50 years ago. So a lot of effort has been put into that. We want to support our community physicians and again create an exceptional place for them to work. That means that they can do their best work in an environment that provides the best care for our community. And again, a landmark building on the campus in this community, which is a source of pride for the community. You know, we are one of the largest employers in Castro Valley, us in the school district, and we recognize the importance we have to the community, not just in that sense, but also in the sense that we create a building that's special for the community. And it's really important to understand that there's no public money involved in this construction at all. This is funded through our company, Sutter Health, no tax money at all, and that's pretty unusual in today's environment. I know that the county needs to replace their hospital in Oakland, and that's north of $800 million, and that can only be done if there's a bond measure that supports that in Alameda County. So this project will be fully funded without tax money, without community support, and I think that's a really important aspect of our work. The service mix in the hospital, as I described, but more specifically, it's going to have 130 beds. We're going to have a 136-bed universal care unit. All of our rooms are private rooms. Now we have a mix mostly of 2-bedrooms and 4-bedrooms. That creates challenges in use of our rooms, and we have different types of patient needs, or families that are grieving, or just gender, male and female. We can't mix patients very well, so it's an inefficient use of the hospital as it's constructed now. Private rooms does away with that. The Universal Care Center is a new concept in hospital design. It's for use primarily for patients who are not admitted, and that is patients who don't have to stay more than 24 hours by our definition. They may stay overnight, but if it's not a 24-hour stay, they are technically not admitted. There are more and more patients who come into the hospital who have same-day surgery and then leave the hospital. And so we'll house those patients in this unit. We'll also house patients from the emergency department that may need to be observed for hours or period of time to determine if they need admission or not. Or the same goes for trauma patients in the same category. There's multiple uses for those rooms. And these are patients that often now get moved upstairs into hospital beds, and again, an inappropriate use for inpatient beds. As I mentioned before, we're going to have a streamlined patient-centered process. It begins at registration. We have a feature called a control center that the team has designed into the building that is going to be the focal point for patients and help patients move through the hospital in a more efficient manner. We'll have an emergency department and an urgent care center. Urgent care center is not something that we have in the same way now. We do have some fast track or some beds in the emergency department to help us move patients through quicker, but this is going to be a different concept altogether. Of course, we'll have the trauma center, the OB services. We're going to have 230,000 square feet of building on the campus. By comparison, this is 235,000 square feet. So essentially the same size building with these services in it. And one addition that we added actually as we got into the project is a medical office building of 80,000 square feet. Again, on the campus, directly connected to the building, and the team will show you some of the concepts around